everybody. My name is Dr. Steph Scott, and along with Professor Amelia Lake, we're going to chair today's session. So my job here is to give you a little bit of housekeeping and tell you a little bit about FUSE, NIHR and SPHR and Nourishing Futures, and tell you a little bit about the programme. I'm going to keep this really quite tight so that speakers have got plenty of time. So yeah, and just to give a little bit of welcome to FUSE, to everybody who isn't familiar already. So FUSE is a virtual centre of excellence in public health research, and it operates across the 6 universities in the North East and North Cumbria.
Cool.
Scarily, we started in June 2008, and I was there from the beginning. And we work in partnership with policymakers, practitioners, and the public. And in terms of those key collaborations, we're talking about local government, health, and the voluntary sector in particular. And FUSE's ethos and mission, if you like, is to translate public health research to enable findings to be understood and applied to public health issues. And FUSE is a founding member of the NIHR School for Public Health Research, which I'll tell you a little bit now. Next slide, please. Brilliant. So in terms of the NIHR School for Public Health Research, or affectionately called SPHR, SPHR was established in 2012, which is and operates as the NIHR School for Public Health Research. And it's a partnership between 9 leading academic centres, of which FUSE is one. And we work in partnership with policy and practice colleagues to deliver high quality research to inform and shape policies that deliver real change to improve the health of the population and our planet. And the most recent renewal of the SPHR school was 2022 to 2027 for just under £30 million. And we work across a number of research programmes, public mental health, children, young people and families, health inequalities, and healthy places and healthy planet. And obviously those programmes intersect, but really crucially what we're talking about here is children, young people and families. Next slide, please. So our third partnership, if you will, for today's webinar is the Nourishing Futures Network, which focuses on nutrition and brings together an international group to lead knowledge exchange and generation on issues of food security during preconception, pregnancy and early life. And this network is led by researchers who work to solve issues related to food insecurity specifically across these important life stages. And the aim of the network is to share knowledge and expertise, to create a platform for collaboration and to bring together research and evidence across policy, practice, the voluntary sector and those with lived experience. And you'll notice just in the corner there's a little QR code to register for the network. We're really keen on new members, so if you do get the chance to scan that QR code and join, that would be absolutely marvellous, and I'm sure it'll be beneficial, and we'll give you a little reminder at the end as well. Next slide, please. So in terms of a programme for today, as I say, I've kept the welcome really, really tight, and I'm going to pass over to Professor Nicola Heslehurst in a minute, just to kickstart with our proper session. But just to give a bit of housekeeping first, I think participant cameras and microphones might be purposefully disabled, but I'm not entirely sure whether the tech has done that, but they should be. And we're going to ask everybody to submit any questions for the panel discussion a little bit later through the Q&A function. So if you do have a question, please just pop that in there when it occurs to you, and Amelia and I will work through those Q&A questions and when we do get to the panel towards the end. We're also recording the session, so the recording will be made available via the FUSE website later. And finally, if you'd like to know more about FUSE or you would like to share anything from today's event, as usual, you can do that through different social networks, so LinkedIn, Blue Sky and Twitter, and use that. We do have a hashtag, which is hashtag FUSE, lowercase, and then capital R and E. We might pop that in the chat as well, just so people can copy paste it. And our social media links are displayed on the slides as well. So I'm going to pass over to Nicola now, if that's okay, and I'm going to leave this now in your capable hands, if that's okay.
Thanks, Steph, and welcome everybody. The first talk today is setting the scene around the Food, Pregnancy and Me project, which I co-lead along with Professor Heather Brown, Professor Kate Jolly and Dr. Kaya Hurley. My slides seem to stop there. So my talk is setting the scene of why food insecurity is particularly important for pregnancy. So I'm sure many people on the call today will know what food security is. Historically, back in 1996, food security was defined using these 4 pillars of availability, access, utilisation and stability. But more recently in 2020, this was updated to include sustainability and agency. and also shift from pillars to being dimensions which are connected. The pillar
It's gone off.
Analogy, I think somebody's microphone's turned on. If people could please mute the microphone, thank you. To reflect the kind of fluid, dynamic nature of food insecurity, rather than the pillars which appeared to be isolated and separate to one another. Thank you to Soybel for this slide, summarising the importance for women in pregnancy. Food insecurity is obviously important for everybody who might be experiencing it, but there are inequalities in who's most at risk from food insecurity. Globally, nearly 1 in 3 women experience moderate or severe food insecurity, and more women go hungry than men, and that gap is widening. And there are lots of different drivers as to why this is more of an issue for women than men. These relate to socioeconomic factors. So, for example, women are more likely to be on low income, to have poorer working conditions, and also the societal expectations that they're main carers in households as well. Women have additional nutritional demands, which can be exacerbated during experiences of food insecurity relating to menstruation, pregnancy and lactation. And then there are physiological impacts on women relating to their diet, weight, mental health and pregnancy complications. So our team conducted a couple of systematic reviews and published them in 2024, looking at the associations between food insecurity in high income countries during pregnancy and maternal diet, weight and health outcomes, and child health outcomes as well of pregnancy. What we found in this first systematic review was that women who experienced food insecurity during pregnancy were more likely to have low diet quality and some nutritional deficiencies in terms of micronutrients, and more likely to have diets with processed meat. When we look at maternal obesity, so obesity at the start of the pregnancy, women experiencing food insecurity in pregnancy were significantly more likely to also be living with obesity, around 53% increase in odds. We also did meta-analysis looking at gestational diabetes. Similarly, women experiencing food insecurity in pregnancy were significantly more likely to develop gestational diabetes during pregnancy. And this is around 64% increase. There was a lot of data included in the reviews on mental health, but this was reported really inconsistently. So we were able to do meta-analysis for 2 mental health outcomes relating to high levels of stress and mood disorder. Both showed really strong associations with experiencing food insecurity in pregnancy. So a 4-fold increase overall for high stress and around 2.5-fold increase for mood disorder. But what we found in the narrative synthesis as well was, regardless of the measure of mental health that was reported in studies, there was consistent evidence of high depression, anxiety related symptoms, lower levels of resilience. So overall, there was poorer mental health regardless of the measure being used. So what do we know about food insecurity in the UK? The majority of evidence, almost all of the evidence that we identified in those systematic reviews, came from North America, particularly the USA. In the UK, we don't measure food insecurity in pregnancy as a kind of a routine monitoring. The Food Foundation did publish some data in January 2024, which showed differences in food insecurity, households experiencing food insecurity according to the children that they had in the household. So households without children, around 12.7% of the respondents to their survey were living with food insecurity. This increased with school-age children, but households with children, at least one child under the age of 4, which includes babies and preschool-age children, this was the highest at 23.6%. So that leads us to the Food, Pregnancy and Me study. So the aim of the Food, Pregnancy and Me study was to identify the levels of food insecurity in pregnancy in the North East and West Midlands in England, to explore how this impacts on diet and health outcomes for pregnant people and their babies, to look at the costs of this for maternity services and wider healthcare, and to explore pregnant people's experiences and support needs. And the overall aim in terms of developing an outcome for this research programme was to develop evidence-informed co-development of strategic recommendations to mitigate the impact of food insecurity in pregnancy. And this was both at a local and national level. So I'm going to stop sharing now and hand over to my colleague Zainab Akhtar, who's going to share some of the findings of Food Pregnancy and Me.